Hey there, everyone, and welcome back to Studying with Stephanie. We're going to continue on our tissue series and we're going to talk about muscle. So, what is muscle? Well, there are two different types of muscles that we have in our body. There's skeletal muscle and then there's smooth muscle. Our skeletal muscle is what we as physical therapists work with a lot. It is the muscles that help produce movement at our joint. And then we have the smooth muscle, which is more for our bodily functions. The smooth muscle is what our organs are comprised of. So today we're going to go more into skeletal muscle. Skeletal muscle is made up of small cells called myofibrils. These are cylindrical type cells. They each have a nucleus in them. Those myofibrils bundle together, and the bundles, and we'll go a little bit more into depth, create the actual muscle itself. So these myofibrils, these small cylindrical cells, create a type of striation. And striation is essentially another word for striped or linear appearance, and you can see the differentiation when you're looking at a muscle between each of those muscle fibers. So it's striated, it's kind of striped as you're looking at it. Our muscles contain multiple cell nuclei, and they also have a lot of mitochondria. And what mitochondria do is they metabolize energy. They are the powerhouse of the cell. So they help us to produce that motion. And muscles, skeletal muscles, are voluntary, meaning that if I think I want to raise my arm, my nervous system is going to send an impulse to that muscle and I'm going to do what I'm asking of it. Versus something like the heart. I can't tell my heart to contract as much as I try. That is not voluntary, that is involuntary. So our skeletal muscles are voluntary muscles. So muscles function to move the joints, to control motion, and to protect and stabilize the joints. Within our muscles, we have different types of fibers. We have slow twitch fibers, which is our type 1. These are highly oxidative cells, so they are the red cells. When we look at our muscles, we can see those striations also have some white, some red, all of that. And the slow twitch fibers are going to be the ones that are getting a lot of the blood supply because they need a lot of oxygen to consume in order to maintain. So they are endurance and postural muscles. All right. And then we have our type 2, which is our fast twitch fibers. These are more white in appearance because they are anaerobic. They don't need a lot of oxygen. They produce and they get energy through different means because they are more of the power and the speed component of our muscle. Each of our muscle has a little bit of a combination of type 1 and type 2 fibers. Depending on the function of the muscle, though, that is when our body is going to have higher proportion of one or the other. So if a muscle like the gastrocnemius has to do more of a powerful move, then it's going to have more type 2 fibers. Then we think about our erector spinae in our back, keeping us upright against gravity all day long. Those are going to be more oxidative muscles, type 1, because they're more for postural control. As we dive into the muscle anatomy itself, each myofibril, so that muscle cell, is wrapped in endomysium. The endomysium essentially divides each cell itself, each myofibril. All of those tiny myofibrils are then bundled into a fascicle, and the fascicle is wrapped with perimysium. And then each fascicle then is all bundled up, and the fascicles create the whole muscle group itself. So if we're looking at the biceps brachii, the biceps brachii is composed of multiple fascicles itself, and the fascicles are wrapped with epimysium. Endomysium is within, perimysium is going to be that middle, and then epimysium is going to be that full outer layer for the whole muscle itself. Skeletal muscle is unique in the fact that its properties, it has 4 different properties that not all tissues have. It is excitable, meaning that the muscle gets an impulse from the nerve, and the nerve can light it up and create motion within the muscle. It's elastic, so the muscle can be stretched and lengthened, but it's also extensible, meaning that it can return to its original length and position. once the contraction is complete. And then it is contractible. So the muscle itself can produce a force. It can shorten up or elongate and produce a force that imposes a load onto the joint and creates movement. So the skeletal muscle is unique in all of those ways, that it is excitable, it is elastic, it is extensible, and it is contractile. We're going to dive a little bit more into the muscle properties. So muscles are highly innervated with not just motor nerves. Motor nerves are the ones that help us move, but they're also highly innervated with sensory nerves. So feedback to our body about what's going on. There are a lot of nerve endings within our muscle. Motor neurons innervate each muscle fibril itself. So each myofibril, that independent cell of the muscle, is innervated with a motor neuron. Now, the motor neuron is actually branched off from a motor unit. A motor unit is one nerve that innervates multiple muscle cells, myofibrils. So that is the nerve that dictates if that muscle is going to fire. With that being said, because it is one motor unit that fires the muscle, when the muscle contracts, it's an all or nothing principle. Each individual muscle cell, myofibril, is not going to contract independently of the rest of the muscle group. So when the muscle is firing, everything under that motor unit itself is going to fire. All or nothing principle there. So a muscle contracts through the release of acetylcholine. So acetylcholine gets released out of the motor end plate or that neuromuscular junction where the nerve actually is integrating into the muscle. Acetylcholine gets released and then calcium gets released. And the calcium helps to move some of those fibers that are wrapped along that sarcomere, and it opens up so that the actin and the myosin can bind and contract. So if that acetylcholine is not released, the calcium does not get moved, does not get released as well, which will help to open up that sarcomere and allow that actin and myosin to bind. The actin and myosin bind by creating a cross bridge. So they grab and they pull, okay? So when we're thinking about muscles, it's really important for muscle length to be addressed, because if that muscle is too close together, the actin and myosin, that sarcomere, if that muscle is tight, is going to not have a lot of room to grab and pull. It already has too many cross bridges. Versus if a muscle is too long and too flexible, well, now we only have a few cross bridges. That muscle's not able to grab and produce enough force to pull those sarcomeres closer together and produce the contraction. So with that being said, it is important to address either someone that is way too flexible or someone that's way too tight. Muscle length balance is very important when it comes to the firing of our muscle. As well, for muscle, like I said earlier, muscle is highly oxidative, highly vascular tissue, which means it has a high metabolism. And when we exercise, that metabolism increases. As well, muscles are awesome because they work together. So we have the prime mover of a muscle, which is going to be the muscle that is producing the most force for that specific movement. And then we have the synergist. And the synergist can actually provide a stabilization or a neutralization. The stabilization, think about the rotator cuff. As you're moving your arm up and down, the rotator cuff is helping to stabilize that ball in the socket so that you're not getting all this jarring motion. So that's a synergist to the deltoids as we're going into abduction. As well, we have the neutralizers, which are going to produce more of a counterbalance. So the scapula has to move through that motion as well, and the upper trap and the lower trap are going to, and the serratus anterior are going to create this upward rotation of that scapula to clear that acromion so that we don't get that impingement syndrome. So those are synergists because they are helping to move and helping to produce the force but they are not the main primary mover. Also in regards, we have an antagonist muscle. So we have muscles that are going to oppose the movement to produce that proper voluntary form that we want. So the muscles are awesome in the fact that they all work together, but a lot of the times that's where our job comes in handy. We need to know if some muscles are inhibited, if they are not wanting to move or to produce any force to facilitate the motion. We need to take a look and say, okay, maybe it's not weakness. Maybe it's just that these muscles are not getting that neuromuscular control. And that's where we come in with a lot of that neuromuscular re-education, facilitating the muscles, getting them to get some tactile cues so that they can start producing force and moving in synchrony and sequencing properly to create good functional movement for our muscles. There are multiple different types of ways that the muscle can contract. The muscle can contract through a concentric contraction, which is going to be a shortening of the fibers. This is something like a biceps curl or a hamstring curl. Those sarcomeres are binding and pulling, and a contraction is produced, force is produced. And then we have eccentric, where the muscle is actually slowly elongating. So the sarcomeres are holding, that actin and that myosin is holding and slowly releasing those crosslinks as the muscle elongates. And then we have an isometric contraction. Metric we think of as distance. So isometric is no movement, no distance of that muscle contraction. So the muscle is just grabbing, holding, and letting go. Grabbing, holding, and letting go. Then we go into the isotonic. So this is the same amount of force that the muscle is being produced as it's moving through the motion. And then we have isokinetic contractions. Isokinetic means the same speed of motion as we're going through a contraction. So I'm technically doing an isokinetic if I'm on a machine, let's say a CPM, and it's set to a certain RPM, revolutions per minute, and so I'm going up and down at 60 revolutions per minute, and it's going to be at that same speed the whole entire time. Muscle contraction is dependent on a few different things. It's dependent on the shape of the muscle, the direction of the muscle fibers, the size of the muscle, and the insertion of the muscle and the tendon into the bone. So this is going to give the muscle with different abilities to contract. We have a couple different shapes of muscle. So we have fusiform muscles. These are muscles that are more linear, and they enter into the tendon in a long and flat manner. So it's a long flat tendon and they enter into that. And then we have pennate muscles. And within the pennate muscle itself, we have multipennate, bipennate, and then parallel fibers. So the pennate muscles actually enter into the tendon obliquely. So they enter at an angle. And typically the tendon can run along the whole length of the entire muscle belly. And then we have fan-shaped muscles like the glute medius. And these muscles typically insert into a common tendon as they insert into a joint. As well, we have circular muscles, and that is something like the orbicularis oris or the orbicularis oculi, those circular type muscles. And all of these muscles produce different forces for the different functionalities. Let's talk a little bit about muscle injury. Typical muscle injuries include strains, contusions, lacerations, thermal stresses, so heat or cold, as well as myotoxic agents such as steroids or anesthetics. Diseases and neuromuscular impairments also can cause injury to the muscles themselves. So the muscles have a lot of different ways to get injured. We're going to talk a little bit more about strains. That is something very common that we see in the orthopedic world of physical therapy. Strains are graded into 3 different grades. So we have a grade 1, which is going to be small micro tears to the actual muscle. This can take about a week to 4 weeks to recover. It's pretty minor. And then we go into grade 2, where we have partial tearing, but the muscle and the tendon are partially intact. This is a little bit more serious. This is anywhere from 4 to 8 weeks of a recovery process. And then we go to grade 3. This is a complete tear, a rupture of that muscle. It could be at the musculotendinous junction, or it could be in the mid-substance of the muscle belly itself. These ruptures typically require surgery, and they can take months to recover after the surgery. Muscle injury is caused, like I said, from all of those different things, but within the realm of sports and movements, the causes can be anything from reduced flexibility, reduced strength, reduced endurance, to poor synergistic movement. Those muscles aren't activating together, to having an insufficient warm-up. So if we just go in cold turkey and those muscles are not aware of what we're going to do and they seize up, that's when we can get strains, as well as poor rehabilitation from previous injuries. All of these things can make us more likely and more susceptible to muscle injury. But the muscles are very good at healing because they are highly vascularized and they metabolize very well. They have high healing properties. The healing, though, is dependent on the type, the severity, and the extent of the actual tissue injury. Phases of healing, the muscle typically goes through 3 phases of healing. We have the destruction phase, which is initial injury. So that is typically the first week of the injury. What's happening is the muscle fibers get injured, they start to retract, cell death starts to occur, ischemia, so a loss of blood flow to the muscle occurs, degeneration, again, ischemia, necrosis, degeneration, that all kind of is one. And then the hematoma forms. So that blood that gets rushed into the area starts to form bruising. And then edema. So edema is going to be that swelling that those cells now release their fluid. So there's going to be more fluid in the area. And then the leukocytes, so those are our white blood cells, are going to come and infiltrate the area to start cleaning things up and saying, hey, there's a problem, let's help. Then we go to phase 2, which is anywhere from 1 week to 5 weeks after the injury. Phase 2 is the repair and the regeneration process of our muscles. So what happens is the hematoma, that bruising forms, and this is going to help to bridge the gap between those muscle fibers that have started to retract. So it's going to bridge that rupture. Our phagocytes, which are the ones that are going to clean up our dead cells, that necrotic tissue that's occurring, and the inflammatory cells are in there and they are cleaning up the tissue and they are bringing nutrients to the area to help start this process of regeneration, bringing fibroblasts to the area. So the matrix begins to form, and the matrix starts forming through fibronectin and fibrin. They produce cross-links so that the matrix can bind and bring fibroblasts to the area and start to produce new tissue. This also produces scar tissue as well. The fibroblasts then are laying down that new tissue, and the tensile strength of the muscles starts to come back. So they're laying down tissue. We're starting to get better actual fiber healing here. And the capillaries start to bud. So we start to get more of that blood flow. And then satellite cells. So satellite cells are undifferentiated cells like stem cells. They come to the area and they start differentiating into myofibrils. So they start changing into muscle cells. And then new neuromuscular junctions form. So those nerves start to reintegrate and produce more connections within that muscle. Then we go into the remodeling phase, which is the last phase of muscle healing. And this is anywhere from 5 weeks onwards. The remodeling phase, what happens is the muscle starts to mature. It starts to return to its normal properties. Scar tissue is starting to reorganize to the lines of stress that we pose on it. As always, scar tissue and any tissue as it's laying down needs to be stressed in a organized manner, in a conscious manner, in order for it to line up properly to the direction of force. And then our functional capacity, so what the muscle is able to do, starts to get restored. And as well, the tensile strength continues to increase if we continue to challenge it properly. And then the collagen properties are also restored within the muscle. So the muscle gets to this fuller healing recovery during that last remodeling phase of healing. All right, so that is muscle. There's a lot of different things within the muscle. As we dive into different types of injury, we'll go in more depth. As we get into more of the neuro aspect of physical therapy, we'll also talk about that motor end plate a little bit more, and also the contractility and all of those chemical processes that occur within the muscle and the neuromuscular junction in order to get those sarcomeres and that actin and myosin to contract and produce the force. But this was the rundown on muscle. I hope it helped. If you like this video, please like and subscribe below. If you found that this helped you, I would love that you share it with your friends. If there's anything you want me to specifically discuss in upcoming videos, please drop it in the comments below. And always, I am here to help you. So if you want some one-on-one tutoring, please let me know. Drop it in the comments. I will reach out to you. I appreciate you being here, and I hope you have a wonderful day. Thanks so much for studying with Stephanie.